Hi everybody, this is part 5 of the video series, and I started to talk about this case study. I should have held off and waited for a new video, but I'll pick up where I left off. So as you can see on the two tests, a test of pragmatic language 2, a standard score of 100, and the social language development test, elementary, a standard score of 98, both of which is at or just slightly below the mean, so within an expected range for this child's age. However, on the Children's Communication Checklist 2, that being the CCC2, the standard score was 78. And this low performance um, was seen on 5 of the use subscales. So the range was between 3 and 6, whereas for content and form, the range was between 7 and 12, which the mean is 10 and standard deviation 3, so it's acceptable. Those scores are acceptable for content and form, but use is unexpectedly low. So some of the CCC2, I think you're probably familiar with it. It's norm reference for children 4 to, I believe, 16. And it has a number of subscales, the semantic scales, the speech and syntax scales, and under form and for use, coherence, initiation, scripted language, context, and nonverbal communication scales. So of these subscales, the concerns for this child, for Henry, are related to use, whereas the standardized test for pragmatics were within normal range. This parent report measure was considerably lower. So the issue here was social communication disorder for this child, and there are 4 criteria that are considered in the DSM-5 for a social communication disorder. That being their difficulty with using relevant and appropriate communication for specific purposes, difficulty adjusting communication style for the circumstances or the person that they're speaking with, difficulty adhering to conventional rules of conversation and storytelling, and difficulty understanding what is not explicitly stated, or figurative language or inferential language. So some concerns on the CCC2 that were flagged, just to give you an example of where they're, without this particular measure, would have gone untapped if only relying on standardized tests. So some of them that the parent said were, it's hard to make sense of what he's saying even though his words are clear. That's on the coherence scale. And then it's difficult to stop him from talking. That's on the initiation scale. And then he doesn't recognize when others are angry or upset. And that's on the nonverbal communication scale. So the issue raised here is that for Henry, that standardized tests alone would be misleading. And parent concerns, which in this case was recognized that Henry had some challenges. And so the authors of this particular study, they created a comprehensive protocol for assessment of social and pragmatic communication disorder. And they included norm reference tests and caregiver report and conversation and narrative samples, including a sample of adult-child and peer-to-peer child interactions. The standardized tests obviously were of limited value for tapping children's pragmatics ability, but language samples were considered to be an extension of to probe further into the parent report on the CCC3 or 2, and expert caregiver report are considered to be better indicators. A number of factors were identified by SLPs who do not use language sample analysis. So as I mentioned earlier, Heilman in 2010 conducted a study where he asked SLPs to how often they use language sample analysis. And some of the things that they said for those that didn't regularly use it or didn't use it at all were that it was difficult to learn, it was time consuming, inaccurate and unreliable, must have advanced knowledge of linguistics to interpret it, no time to record and transcribe language samples, so they scribe live and consider that it's good enough, and they collect language samples wherever they can because they, on the flip side, that language sample analysis is the answer to everything, which that, of course, isn't the case either. So these are some of the things that clinicians said. And like I said, the benefits outweigh the challenges, but it really means that having access to training, if it's difficult to learn, and finding ways to expedite the process, like I mentioned with Google Speech, and possibly using different tools as that maybe take less time and can elicit the kind of information that one's looking for. You saw in the video that one of the children did a retell for Frog, Where Are You? And this is a sample for a child who's 4 years of age. And so what we can see here in this language sample and the benefit of it is, so I want you to kind of look at this and see if you can see any tier 2 words. And I'll wait just a second. All right. Stop the video if you want to keep looking, but I'm going to, for the sake of time, I'm going to go ahead. So hollered is a linguistic verb, but it's also a tier 2 word because he called at the frog, or hollered is much more specific vocabulary. It's telling you how he called for him. The other one is climb, because they could have said he was gonna get up that tree from the bees. And so although climb might be considered a more high frequency word than hollered, it's still considered tier 2 because it's more specific. It tells you how he got up on the rock. All right. And so in terms of the features of literate language, we see the little boy. So that's an elaborated noun phrase because it has a determiner and it has an adjective and the noun. We also see that we have some embedded clauses. So the frog got out when he was asleep, when he was asleep. So when is a subordinate conjunction, and he was asleep is, this is our dependent clause because it can't, when he was asleep, it can't stand on its own. And we see another one here, we see another one here. So, so this child is using complex syntax. Even though these utterances are short, you can see that if we only value mean length of utterance in words or morphemes, that we might miss that this child is using complex syntax. And so let's see. So the frog, he climbed on the rock and thought that the frog was there. So here we have a conjoined verb phrases. So it's not at the clausal level, it's at the phrase level, but still climbed and thought are paired together in tertiary branching. And he said bye. So this is also considered complex because goodbye to you is the ellipsis there. And he said is a subject predicate pair, so it's also a clause, and bye is dependent on it. All right, so looking at these challenges for SLPs, as I said, there are a number of forms that could be used, and yet and it requires that the SLP feel confident in doing language sample analysis because it provides a rich source of information. And then diagnostic decisions, again, back to the Dr. Archibald's flowcharts in lecture 4, that making your diagnostic decision based on all of the information that you've gathered. And of course, written language assessment. So we want to pair oral and written language as often as we can. And so written language, in terms of, there's two distinct aspects of it. There's word reading and or word recognition and decoding, and there's comprehension, reading comprehension. So we assess them separately. So for word reading, we're looking for fluent and accurate word reading, and this is foundational to reading comprehension. You can only understand what you read when you can read fluently, because if your reading is too halted, the boy went, right? If reading is too halted like this, being able to gather the meaning becomes difficult, because all of your cognitive resources are focused on decoding, just interpreting what the printed words are. So there's several factors that go into what we should include in a word reading task. So we have to consider the age of the participant and the nature of the word items in the test. So we want exemplars of problem areas, but we don't want a high degree of difficulty for that's above this child's age. So we need to make sure that the measure is age normed for this child, or that the words that we're choosing, if we're creating our own measure, are at a level of that the child can read. And there are 4, or might be expected to read. There are 4 different types of words. So regular words, irregular words, consistent, and inconsistent. And what we mean by regular words is that they conform to a grapheme-phoneme correspondence. So words like jump and start and, beg, right? That there's a one-to-one correspondence with the phonemes, grapheme-phoneme correspondence. Then irregular words don't conform to grapheme-phoneme correspondence. So those are words like yacht and kernel. So kernel being spelled Colonel. These words are considered irregular. Then we have consistent words, which show a common spelling with other words, and it's predictable. It has a predictable pronunciation. So words like book, look, took, that combination always sounds like ook, right? Whereas inconsistent words show a common spelling pattern that can be pronounced in different ways. So for example, mint and pint. So a pint of whipping cream versus to eat a mint, right? They're both spelled with INT, but the pronunciation is different. So we do need to be sure that the words that we're asking the child to read are appropriate for the child's reading level, and that they're not in the extreme. We also may want to examine precursor skills like phonological awareness, letter knowledge, rapid automatized naming, which is relevant for being able to go in and access that orthographic form and being able to say, pronounce the word. So be able to sort of access its phonology in an efficient way. So rapid automatized naming. All right. So for word reading assessment, we're going to assess words, non-words. So we use non-word reading. It's also referred to as word attack because it's straight decoding. So for the most part, there's only one way to pronounce the words, although they're not real words. They are words that could be, so we call them accidental gap in linguistics, that they just don't happen to have meaning associated with them. And we see measures of both word reading and non-word reading in our in the measures that we'll be talking about coming up. And then fluency is looking at the automaticity of reading. So how well can they read words automatically, like see them and say them? And we do that by timing how long it takes them to read a passage or a list of words, and dividing by the number of words that they read. All right, and then in terms of reading comprehension, we see several factors that need to be considered for what to include. And so oral language is key, of course, for comprehension. And then there's different types. There's true-false sentence judgment, multiple choice, closed task, and open-ended questions.